Hello, and thank you for tuning in to the Without Distraction Relationship Broadcast. I am your host, Dr. Ingrid Durr Russell. We have our special guest back again, Cheryl McCrary, CD recording artist, and she also sung in our relationship conference. And her band, live band, was there, and we just had an awesome time, and you're going to hear her singing on this show. Thank you for coming back.
Well, thank you for having me back. It's great to be back on the show with you.
I'm glad you're here. Well, today we're going to be talking about relationship, but if we're going to be dealing with relationships and how it affects your health. Sometimes people don't believe that your relationship can affect the way your health is, and also can set up and create things in your body that you don't realize where it came from. Mm-hmm. But sometimes it could be from the stress and everything else that we deal with. But first of all, Cheryl, how did you first start going into the medical field, and what were some of your experiences?
Well, being in the medical field, working as a nursing specialist for about 15 years, allowed me to really dive into really what are the health issues causing the health problems. Mm-hmm. And through working with patients and specialists and continuing in the medical field, I found out that stress is really a major concern for health issues. Yes. Primarily heart problems, diabetes, and cortisol is released in the body when anybody, males or females, are exposed to overabundance of stress. Mm-hmm. And again, since now, as we see in our society, that obesity and high blood pressure and CHF or cardiac congestive heart failure is one of the primary areas of concern in our society today.
Yes, oh wow, that's amazing. So with your experiences, you've been in the nursing field how long?
It was about 15 years. I worked for a general practitioner. Okay. And through that time, we actually were able to talk with the family and or patient regarding areas of concern with their health, whether it was high blood pressure, what was their job like, are they under a lot of stress at their home, is there any type of violent experiences that they're having in their home environment that might be bringing the causing of the high blood pressure or the diabetes to be increasing. So a lot of times we go through an evaluation when we see the patient, go through medical history, is there any domestic violence? And if we can catch it at the root, then we can find out if there's abuse or anything happening in the home causing stress or any type of systemic problems at work that might be causing elevation of stress in their lives.
So in other words, some social issues can affect a person's health as well.
Definitely.
So if they're going through financial crisis,
yes,
and going through marital crisis,
yes.
What about dating?
Yes.
In a relationship?
Yes. Again, dating in a relationship, getting to know that other person, as we've shared on the show before, that could be stressful as well, especially if they've come out of an environment where it wasn't real healthy before, or their upbringing was not healthy, or they've been abused in any way. Again, that stress can elevate on a health, on a persona as far as your health. Again, blood pressure is very much critically affected by internal stress, especially if there's stress you haven't dealt with and it's still underlying and you haven't told anybody and there's something severe happening. So that again can also be a concern if you do have any concerning issues in your home, or even if children are being bullied. There could be stress as a child with the stress that's happening with the kids in school with bullying today.
So if a person's under stress, how just tell me what happens when their body start feeling the effect of what they're going through in their mind and in their thoughts, the stress itself. What are some of the things that they go through and people go through in their body to determine, hey, I must be under stress and my body's under stress? What is it?
One of the primary targets that you might want to be aware of, first of all, get an annual checkup. Okay. I recommend an annual checkup by a physician that you can trust, somebody that you know that's reliable, has had good references. You can go online to check on their bio as well. I would recommend that first of all and foremost. Secondly, when you do have your exam, you will be asked to have your weight checked and your blood pressure checked. And I would also recommend a complete blood work, CBC, and a urinalysis to also include with that. And if you check with your insurance, sometimes you do have that is covered as well for a routine exam. But I would start there with your family practice doctor. And another thing that you might want to look at is if you do have areas of heart problems. You might have some areas of tachycardia, which means fast heartbeat. Bradycardia is lower heartbeat. If you feel like you're having some chest sensitivity, of course, by all means, get to your emergency room quickly. And so the stress that you have that maybe hasn't been dealt with as maybe we were sharing just a little while ago, that builds up and causes an increase, and it puts a lot of pressure on your heart, not only psychologically, but on your heart. And when your balance is off, oftentimes your blood sugar or cortisol will be, it's a hormone called cortisol, which your body will make more of, and that again is now again with stress and your health will increase your weight gain.
Yes.
That's another big concern today.
Yes, and you mentioned about obesity, and it's one of the things I found out too, and I found this out recently. I'm not a nurse or anything, but when a person is dieting and they go on and off a diet, that also increase the negative fat in their body, because we have the good fat, but then we have the negative fat that is against our body. So when a person's going on and off, the negative fat will begin to create layers in your body, and it just goes to on organs and whatnot that it shouldn't be. Is that true?
Yes, there is. That's definitely a concern with the fads now with on and off dieting. That actually is very unhealthy. Again, that is true because you're dieting and yet your body is eliminating fat, but it also is eliminating good muscle. And what we encourage is water is a very good thing, water consumption. And again, if you do want to start looking into a conscious setting of what you're doing, evaluate what you're eating, when you're eating it. Again, reflux, as we shared earlier on the other show, can affect a person what they eat, and going to bed late and eating late. And maybe with people going through stress, they tend to go to the sugars, or they go to the salt products, or the sodas, or alcohol, or drugs, or sexually become more active, and all these areas to escape from the stress level that they haven't dealt with comes out in these other areas. And again, even with cancer on the rise now, awareness. I'm an advocate for that as well. And with a grandmother who did have breast cancer and had the full mastectomy, and I do get checked regularly. But I would encourage women for the mammograms that they're also promoting for women, because we all do have cancer cells, and again, stress will crave any type of stress.
What age do you recommend that the women get their mammograms?
I would recommend any woman that is actually 18 and over.
18 and over? Okay.
If they do have problems, if they don't have, actually the self-mammogram testing can be done on a manual testing, and you could pick up the diagram information at any clinic. If there's problems for a young woman who might be fibrocystic, for example, again, that could be hereditary, or it could be just maybe something in her diet. But if there's problems, but other than that, women usually over the age, I would recommend probably after childbirth, if they've been a mother, again, make sure that they do self-examinations. And also probably any time, after 30. And if you do have cancer in the family, of course, I would highly recommend a routine mammogram, ultrasonic or diagnostic.
Because when I was younger, I was told that 30 and up start checking, for them to start checking, to get the professional check, not just the self-check. But like you said, if a person have already have experience in their families, it could be genetic, it can be inherited somewhere in our body, and so you recommend that they start checking at the age of at least 18 or after they have a child or something.
Yes. Upon menstruation, when a woman does start her monthly cycle, again, hormonal changes are happening between 12 and 18. And at that time, If the young woman is instructed through her OBGYN, when she gets her first checkup between 18 and 21, they will do a self-instruction to let them know, how to check them. But again, this stress is all related to, again, all these different type of problems that can happen within our body can be related to a lot of underlying stress that might be going through, getting back with the weight problems and so forth.
Yes, the weight problems and also unresolved issues, and sometimes that can cause distress and then cause the pressure on the body. The body knows what's going on when you're under stress.
Yes.
And people can be under stress in many different ways.
Yes.
And so one of the ways you were saying the excessive gait waning, excessive weight gain, and also what were some of the other things you mentioned that?
Another area with the diabetes is another big rise now. A lot of people do not realize that we have sugar in ketchup. We have sugar in areas that we don't even know we have sugar. So the new study now is not just that if you have a high elevated LDL, which is a lousy. If you have that, I remember if you have LDL, it's a lousy one, and the HDL is the good cholesterol level checks. Now they're finding out not only cholesterol will also increase heart and any type of CHF, cardiac congestive heart failure, but also sugar is also another contributing problem with cancer. That cancer thrives on sugar.
Oh wow!
And so it's very, very much a new awareness study now that's coming through some of the New American Journal for Medicine that sugar is also another cultivating concern with diabetes and unresolved diabetes with juvenile diabetes and or late adolescent or even late in life diabetes. Another area that's concerning besides that is depression. A lot of people,
that's a big one.
Yes, on a mental health capacity, that stress will also affect you. Depression, and again, mentally cause a lot of anguish, unresolved anger, bitterness, again, abuse at the home, are other areas that can be of concern.
Yeah, because people have a tendency of harboring things, and when they harbor things, they don't realize that it's affecting their body. Just like I know someone that told me that he developed ulcers because he had unforgiveness in his heart, and he was holding resentment against someone in his family, and so eventually ulcers began to get developed in his body, and that's the first time I've ever heard that what a person is going through can affect them physically, and just the ulcers and all these growth and all that affects us because we're not designed to hold these things and these issues. We have to deal with those issues and begin to talk about problems, and everybody should have a healthy outlet so that those things won't develop in our body, so it won't become detrimental to our body.
And again, with the health issues, if you're able to realize and find out what the culprit of why you are gaining the weight. Look at your nutrition in the morning. Are you drinking enough water? Are you eating and supplementing with vegetables and fruits? Even sometimes a fast off, for the day, as we were sharing earlier. Just detox and let your body flush out.
Yes, detox is so important. And even people that's fasting, whether you're fasting for a political reason, a religious reason, it doesn't matter what you're fasting for. But I found out that when you're fasting, and if you don't detox, then you kind of can put your body in a shock. Whereas fasting it can help a person's health, can help promote healing, but it's a proper way of going into fasting, and that is to detox first and then go into the fasting. And also when you're coming off the fast, don't start attacking the food and like, I missed my meal for 3 days. Now I get it already. I'm going to just go ahead and go at it. No, that would put your body in shock too. And also it would develop the unhealthy fats as well in your body. But so course, just like you detox before you go into the fasting, but also when you come off the fasting, or sometimes the doctors will put you on a fast for your health reason. But we can't go into it overindulging. We have to go into it gradually, starting back drinking more liquids, fruits and vegetables to help your body get used to and adjust to to the food as you're going back into eating on your regular eating habits.
Yes.
So
again, I would recommend checking with your doctor to let him know if you're doing a type of weight program. Also check with your doctor. Another thing on the flip side, again, when you go through stress, exercise has been one of the best ways to alleviate a lot of stress. If you have a very busy businessman who travels and he's actually on the road a lot, you'll find that a lot of the hotels will have a fitness center, which is really great to have, and they can actually have that so they can exercise. But exercise has been one of the best, I believe, for everybody. If we can actually get back to exercise. And years ago when we were little, we all went out to play. Now the kids are on iPods and their iPhones. I'm not knocking that, the new medical, the new technology. But again, to be active and get out, start with a walk or get a treadmill or get, a stair climber, something that you can feel comfortable with. And do it as a family, do it as a team. Mm-hmm. If the family itself and there's marital problems and kids are getting heavy and people are gaining weight, start with the beginning of what you're eating. Start with fresh fruits, go to organic, reduce the salts in your diet, and deal with the marital conflict if you're having problems. Again, the studies have shared that women who have gone with relationships from one to another have had increase
multiple relationships
of health problems.
Well. Yeah.
Exactly.
Wow.
So that's been a major concern. And again, that's just something with marital conflict, stress, and again, all that ties in with our health.
Yes.
General well-being.
Wow. So what can we do to overcome these health issues that we have? America is known for health issues. We know the American diet, what we eat, all the processed food, and all of those things, it really affects us. But what can you say to give us some really good healthy tips? Because I know you're good on healthy tips, and tell the audience what we should have in our diet.
I believe, again, as we were sharing, water. Not soda, not orange juice, water. Mm-hmm. And look at your labels. Start looking at your labels, and if you want to go online, look at your labels to see what's in that food.
Yes.
There's a lot of food preservatives and food coloring, and again, some of these very things that you don't realize may be causing a problem with reflux or acid problems, or maybe you're even allergic. We have had a patient that actually was allergic to the food she was eating, and she was lactose intolerant. So she was very gassy. So again, this all starts with your physical exam, sharing openly, honestly with your doctor. Third, exercise. I can't stress that any more than that. Exercise is very important. Even if it's a walk around the block, start small, work your way up. Do it as a team. Get a friend or a co-worker to do it with. That would be very important. And again, your faith. I really believe, trusting in God as I have for most of my life. It's been a blessing, knowing that God's there. But again, having that faith that through conflict, through the stress, and through just changes of life, we can just know that He's there for us. And again, dealing with the stress internal problem that might be causing the problem. Mm-hmm. If you deal with that, get the counseling, talk to your pastor, talk with your family, trying to deal with the stress that's causing the problem, again, will be another opportunity to relieve and cause a better overall health-wise.
Oh my, wow. You're listening to Without Distraction Relationship Broadcast, and my guest, Dr. Cheryl McCrary, CD recording artist Cheryl McCrary. And I'm telling you, she's a singer and her experiences in the nursing field. And we're just talking about how the body operates in the stress level and things of that nature, and some healthy tools and things that we can eat, and what about some things that we can avoid eating that will help us all. And so let's talk about that. What are some of the things that we should avoid eating?
I would definitely stay away from a lot of the oils in the products. Again, look at the safflower oil, look at the corn oils, and look at these areas that are a little bit healthier. I would also very much watch as far as the cereals. Moms watch the cereals that the children are having because there's a lot of sugar. Go to the brands. Try to get the brand. And as we get older, another concern, we can be open here on the program, as you get older, things slow down. Your metabolic rate slows down, your acid reduces, your enzymes reduce. Again, another area that we need to increase your enzymes. and peristalsis. Another concern is people can't, have proper elimination, and they have areas of concern with, constipation. And areas of concern there. So fiber is very important. So again,
so it's good to intake fiber.
Intake the fiber and pull back on the high complex carbs. The white, don't bite white again. But look at your wheat breads. Some of them still have the white flour in them. Look at your organic 12 grains on your breads. Buy fresh fruit and wash your fruit, because there are chemicals that are sprayed on there for preservation of the fruits. Again, wash that fruit. And there's nothing wrong with frozen vegetables, but again, look into fruits, vegetables, stir fries, and be careful on how much meat you eat as well, and maybe go to organic on that as well.
Oh wow! So that's a lot that we gotta look at.
Yes.
We have to pay more attention to what's on the label.
Look at the label,
because sometimes the bad stuff is in small print.
Exactly, and you don't understand it. Google it. Bring your iPad with you and Google it. But go to organic if you can, chickens, and watch the meat consumption. I would really encourage fresh fruits, soups, and healthy type of even smoothies are great with yogurt. I would love to increase increase your acidophilus in your diet. Eat some healthy yogurt or Greek or yogurts as well.
Yeah. So what if a person has lactate tolerance? Would that yogurt help?
They can actually take, there are supplements like Lactaid that you can take if you are lactose intolerant. There are different milks out there, even for regular milk consumption. There's soy milks, almond milk, and coconut milk. It's been a very high increase area. Coconut milk and coconut oils to cook with. Another area. Stay away from fried foods. Fried foods, again, peel off the chicken if you have to, the breading.
The skin? No, not the skin.
Yeah, I'm telling you.
I didn't want to hear that
Chicken breast broiled and buttered and, onion powder.
But they say get rid of the skin because the skin is unhealthy.
That's the
especially
stuff.
the fried, but who do that.
Yes.
But it's good to do. That's something we should pull back.
Definitely.
And that's why sometimes we got to balance ourselves and going to more baked food.
Right.
Baked food and things of that nature, so we won't eat a lot of fried food.
Right.
Now that I'm getting older, I'm starting to do more baked food and cooking more healthier. But it's just really great if someone can catch it early.
Yes.
Because if we can catch it more earlier with good eating habits, then we can eliminate a lot of the sicknesses and stuff that's going on in our American diet and our bodies.
Yes, definitely.
Because of what we eat, the processed, the unhealthy fats and the saturated food, all those things really affect us, and that's why we have a lot of people develop all types of sickness and major sickness because of the way we eat. So I think you're giving us some really good tips to help us along the way, help people along the way we can have a better life.
Yes.
There's a scripture I must mention. It says, God wants above all that we'll prosper and be in health as our soul prosper. So I had to say that one. But so we've got to be well rounded and balanced. Yes. We can't just go along taking life. Well, I'm going to just get the religious part and don't get the physical part and get the balanced part in life. We need to be balanced in all areas of our lives.
Yes. And again, dealing with stress and your health is, again, target the stress areas. Find out what they are. Find out the resolve. Get the counseling or pastoral support you need with coworkers and so forth. And again, your stress will relate to how you are health-wise. And again, any type of stress you can avoid and increase the exercise and nutrition will be the best you can do for yourself. Oh, wow. Thank you. CD recordings, Cheryl, McCrary, thank you for being with us. And the song, oh, wow. Awesome. And be glad for you to come back again. Thank you very much. Again, you have tuned in to Without Distraction Relationship Broadcast. Call us anytime. It's 708-745-4393 or tune in. Check us out on the website at withoutdistractionrelationship.com. Thank you and be blessed.
When I fall in love, it will be completely. Oh, fall in love with you. When I fall in love, when I fall in love, it will be so completely, or I'll never fall in love. Oh, in a restless world like this is, love is ended before it's begun, and too many moonlight kisses seem to cool in the warmth of the sun. Oh yeah, when I give my heart to you, it will be completely, or I'll never give my heart. And the moment I can feel you, oh, you feel that same way too, is when I give my heart, oh, I give my heart to you. Oh, when I give my heart completely, I give my heart to you. Oh, I want to give my heart to you. It's someone I can trust. When I give my heart